25th week of pregnancy. Pregnancy symptoms in the 25th week. The 25th week of pregnancy constitutes the second trimester of pregnancy. Among the important observations that characterize this stage are the following. The nausea and vomiting that characterized the first trimester of pregnancy disappear. The height of the uterus is slightly higher than the navel, and the pregnant woman feels the movements of the fetus greatly. The increase in weight continues, increasing at a rate of 7 kilograms since the beginning of pregnancy. The milk glands in the breast gradually increase in size due to the stimulation of the hormones estrogen and progesterone. The breasts enlarge due to the continued accumulation of fatty tissue inside them, and this is accompanied by congestion and sensitivity. Mild and irregular contractions of the uterus occur as a result of its rapid growth, which are called Braxton Hicks contractions, due to the stretching of the uterine muscle fibers. The skin, especially in the abdomen and face, stretches and becomes shiny thanks to the increased blood flow to it. Dark pigmentation will be more noticeable if your skin is originally light in color, especially in the areolas of the nipples and in the line of the abdomen that extends from the navel to the pubis. The blood vessels dilate as a result of increased blood flow due to the influence of pregnancy. Hormones. Blood pressure drops and you sometimes feel dizzy, especially after standing for long periods and quickly moving from a lying or sitting position to a standing position. Swelling occurs in the nasal mucous membranes due to the increased blood flow in them. Snoring increases due to partial obstruction of the breathing channels. The gums become swollen and more sensitive, and they may bleed sometimes when brushing the teeth. Fetal development in the 25th week of pregnancy. The development of the fetus during this period is as follows. The fetus is about 34.6 centimeters long and 0.66 kilograms in weight. The fatty tissue begins to accumulate in the fetus and its organs continue to grow. The process of rapid development begins in the brain, and there is an acceleration in the growth of the lungs, and blood vessels inside the lungs begin to form. The nostrils are opened for the first time and breathing movements can be seen through an ultrasound examination. The fetus's sense of hearing is well developed, and at this time it is able to respond to sounds. The first stool that the baby comes out begins in the first days after birth and with the beginning of breastfeeding. Permanent tooth buds begin to appear in the gums, which are those that replace milk teeth after they have fallen out. Follow-up of pregnancy in the 25th week of pregnancy. Among the important examinations during this period are the following. Routine pregnancy follow-up examination by the doctor during this period. The following are examined: blood pressure, pulse, weight, the presence of edema, measuring the size of the uterus and its suitability for the week of pregnancy. Ultrasound examination. The doctor asks if you feel the baby's movements, and the test can be completed with a routine ultrasound to demonstrate proper fetal growth. Determine the amount of amniotic fluid, and watch the baby's body movements and breathing. Glucose tolerance test. If you haven't yet had a glucose tolerance test to rule out gestational diabetes, the 25th week of pregnancy is an excellent time to do so. Days before the glucose tolerance test, you must eat normally to get a good result. And it is usually recommended to eat lemon after drinking the sugar solution to avoid nausea. Other examinations. It includes examination of laboratory results for hemoglobin, urine examination of both general and cultured types, as well as antibodies to the Rh factor.